Good evening, everybody. Thank you for having me come and talk with you for a while tonight. My name is Scott Stanley. I'm the owner of Caring Hands Caregivers, which are a small caregiving agency located in Cupertino. We handle mostly Santa Clara and San Mateo counties. Just quickly, a caregiving agency, we do what's called home care. What home care is really someone that comes into the home, a caregiver, and provides that extra level of support to assist with the activities of daily living, they call it. It's helping with any sort of meals, it's helping with showers or getting dressed or whatever the person needs to do to kind of get through the day safely. We're not what's called home health. And I want to kind of distinguish between the different types of agencies or different types or names you might hear. We're home care. There's actually something called home health. Home health is when you have, it's paid for by Medicare. It's when somebody comes out who is a nurse that does a case manager. They'll come out, they'll actually send out physical therapists, occupational therapists, whatever kind of specialized, skilled type of services that are needed. So they come and they go. You know, they come at certain times and for a certain length of time. Caregivers, we provide the support, the home care provides the support in between all that. Okay? So I just want to make sure it's one word, but it's a big difference in kind of what happens. And if you're going through the process, you may hear both of those and be a little confused about which one is which. So we're home care. So we have caregivers that we bring into the homes of the families that we support. And, you know, I guess kind of what our agency, our caregivers do, they come in and they make sure, number one, that person is safe that they're caring for, make sure that person is comfortable, make sure that the person is cared for, that their needs are being met from a perspective of, are they getting the nutrition that they need? Are they getting exercise that they need? Are they getting are they clean? Is their house, safe for them to move around? And do they need help moving around to make sure there isn't a fall or anything like that? So we really provide that support in the home. And our services range anywhere from, we do 4 hours, okay? Where we can come in for 4 hours a day or, once a week or twice a week. And we really scale. Our agency does the full gambit. But it's anywhere from like 4 hours a day to we do a lot of 24/7. So somebody who needs somebody there the whole time. And we find that the families that we work with, many of them start with smaller amounts because they don't need it. We don't want, you just need the help that you need. But later on, the needs become more intense, or that family may need a little bit of a break or a respite. And so we can provide services that help that caregiver get some time away. Really what we try to do is take some of the stress off of that caregiver that's there, that's part of the family, or that's a friend, or whoever is there supporting the person, and give them a little bit of a break. We kind of talk about in our agency, we want to get spouses back to being spouses and children back to being children. To kind of get that relationship versus just the caregiver, because it happens so fast and it builds and it builds and it builds, and the caregivers aren't taking care of themselves. And so we kind of try and help them get some of that time and the me time back. Or, get back where you're just working with them as the person that you used to know versus the caregiver. So we do all the bad things, like you have to do your exercises or you have to do this, because they don't like to listen to the family sometimes. So sometimes we can get away with it. We're what's called, our agency, we actually hire our caregivers, so there's different types of caregivers that you can find out there. There are W-2 employees of our agency, so we hire them, we pay all of their taxes, their payroll taxes, we pay their workers' compensation, so if they're ever injured on the job, we're responsible for that, not the family. We have liability in case something happens. We have dishonest bonds in case there's theft or damage or anything that may happen to the home. So we're fully covered, so that's one thing the family doesn't need to worry about, okay? We have that all. We also manage those caregivers, so if you have a caregiver you like, you can keep that caregiver as long as you like. If there's a caregiver you don't like, well, guess what? We have lots of other caregivers, and we'll work with you to make sure we get the right caregiver for you. So, the other ones you might hear, there's something called domestic referral agencies where they'll introduce caregivers and they'll help screen them and they'll do background checks on them. But then you'll ultimately be their employer. You private hire them. And then there's also private caregivers that you can find sometimes through churches, sometimes through, ads, sometimes through just people that that have had private caregivers before. There's pros and cons to all of them. We choose to do we hire our caregivers just because we feel that we can provide, a level of management and service that goes above and beyond. We take that away from the families. Where do we find our caregivers? When we first started out 6 years ago, a lot were off of Craigslist. But over time, we've tried to make sure we pay our caregivers a little better. We make sure we're in constant contact with our caregivers to support them. So a lot of caregivers refer their caregivers to us, which works out pretty well. So we know we're doing our job right when they're referring their friends because we treat them well. And really, the caregivers are the agency, I can say a lot of things. We can do a neat website, but when it really comes down to it, it's that caregiver in the home of the person that they're caring for that makes the difference. And so we really try to make sure we understand that and appreciate who's really doing a very difficult job. So when we hire our caregivers, how do we hire them? We've got a whole process that we set in place. And you can look at this and take this if you're going to be talking to caregivers. But this is kind of how we approach it. When we get a caregiver that calls in, we phone screen them first of all. And if we can't understand them on the phone, because a lot of caregivers this is not their place of birth or origin, and they have very thick accents. And if we can't understand them on the phone, we don't ask them to come in. Because the people that they're caring for probably can't understand them as well. If they're good on the phone, we bring them in and we have them complete, first of all, we have them complete an application online that they complete, and we get most of their information. Then we bring them in and we have them write out a couple more questions. We want to make sure that it wasn't somebody else that filled out the application, and we want to understand their ability to understand and speak and write and things. So we do that. Then we have two people sit down, we talk with them for about an hour, and we go through their background. And when we screen for experience, we found that the caregivers that work best for us, they have about 3 to 4 years experience minimum. Some of them have experience as being private caregivers, but we also like to see if they've had any training or experience in a facility, where it's much more, they're very, very regimented in how they approach things in the facility. So it's a lot of good basic training. And so we make sure they have that kind of experience as well before we bring them in. But that's a good one to look for no matter where you're going with this. So then after that, we talk to them for an hour. And we ask them not just what they do, but how and why, and try to get to the heart of why they're caregiving, how they handle different situations with very, very specific behavioral questions. They pass that, then we go ahead and we bring them on board. We do a full 7-year background check on them, both federal and state. If they're driver's license, we do a DMV check to make sure that everything's legit. We make sure they have any certifications. We have their certificates on file. If they need, a tuberculosis test, we get that. If they don't, what we typically do is we send all our caregivers to a clinic where they'll go through a TB screen and a fit to work before they come and work for us. So we really try to go and cover all the bases before they even start with us. And then when we send them out on jobs, we typically send them out with somebody that's more of a senior caregiver. So we kind of get the experience there, and we get feedback on how they're doing. So big questions. I think to ask them if you're interviewing a caregiver is just kind of not just who they care for, but how did they care for them? What were the toughest things that they experienced while dealing with a family? How did they handle it? What could they have done better? And try to get them to open up, and not just say, well, what did you work and did you work with this experience? Really try to figure out how they did it. So anyway, that's kind of how we hire our caregivers. Yes, sir.
You mentioned that you do TB screens, right?
Mm-hmm. Yes.
What's happened for people that come from foreign land and they do have the screen, they're done in the homeland, how would you treat those individuals?
We would send them again. You know, unless they're,
They've been vaccinated a long time ago, so always the TB would be positive.
okay, well, sometimes we see that many times with Filipino caregivers, and many times we have the chest X-ray. Just unless there's a very valid record we can see, So okay. So that's kind of how we hire caregivers, and what you can expect them to do, on site is really provide care for the person they're caring for, and make sure that they can do meal prep. They can do laundry. They can do, they can keep the house clean. Now, they can't do like spring cleaning. That's not what they're hired to do. It's called light housekeeping, and the wage rules in effect say it's about 20% of their time can be done housekeeping. So it can be doing exercises. It can be taking that person out to do the things they used to do or want to do, but maybe lost that independence. If we can create and have the caregiver be able to provide that independence or provide that support so they can gain independence, that's kind of what we strive to achieve. So, I mean, the caregivers, their main purpose is to keep that person safe, keep that person well cared for, and keep in communication with us, the agency, or the families, to let us know if anything's going on. Yes?
Yeah, that's my question. How does the caregiver communicate to the family of what's been done or any issues that have come up?
Well, there's.
Can you please repeat the question, since
Oh, sure.
if we're doing questions now, then we need to repeat them so that the video camera will get them.
Okay. Should we hold them till the end, or just go ahead?
I don't care. Just
Okay.
in any event, if you're going to take a question, please repeat it, just so the video can. Thank you.
Okay. Okay. So, your question again? I'm sorry. That's okay. Yeah.
How does the caregiver communicate
Okay.
to the family of what's been done during a session or any issues that they want to alert the family to?
Okay. So how they communicate, there's a couple of different ways. We keep a log in the home where they make notes, number one. So there's always a log of kind of what's been happening during the day. If something, we kind of set up in advance when we come in and talk to the family, a chain of communication in terms of, who do you want communicated, or talk to first, or who do we go to if we hear something. The caregiver will be texting one of us in the agency, if there's something they're concerned about, or if it's something, we also train them on, what to do if you think there's a stroke, or you look for signs, and then there's a clear 911 situation if that's what they're instructed to do. But we make sure we communicate with the family. Either they come through us and we call the family, or sometimes the caregiver, if the family wants us to do that, have them contact directly. Okay? It can be email, it can be text, it can be calling them up. Yes?
Do you see those logs yourself? If your caregivers, families, if they're caring for family members who are away, do you see the logs? Do you get that information directly, or do you just rely on the caregivers to tell you what's going on?
Okay. So the question is, do we review the logs? And do we take a look at them? How do we get the information at the agency office? And do we, yes. So we review them. We're out on site, and we have a rotation of when we go out to visit our clients, and we make sure we capture those. And we take them into the office. We store them. We read them. We make sure that we're taking a look at what's happening in the home. Okay. So, I mean, that's what you can expect the caregiver to be doing out there. They're kind of running the home in a 24/7 situation. They're kind of running, making the house move forward and keep it going for this person that may not be able to do it. Okay. I'm trying to think of other areas that you want me to cover. I mean, that's pretty much what a home care agency does. We try to really adjust ourselves to what the family's looking for, to what the medical professionals are asking us to do. If it's a hospice situation, we go under advisement of the hospice team. So we almost become a part of their team. And so we take instruction from the case manager, from the doctors, from the people that are running a hospice, and we provide the support, with their guidance. And we're still involved, the agency, but the caregivers kind of really almost bolt under that organization because they're really running the care at that point. Yes?
So then are you saying they watch the diet, they do the cooking?
So they're asking if the caregivers will watch the diet and do the cooking. Yes. So what we do is we sit down with the family, with the, if we can, with the doctors too, and go, okay, what is the plan? What do we need to watch out for? Is this person a diabetic? Is this person hypertensive? What can this person have? What can this person not have? And so if they're preparing meals, yes, we make sure that they prepare according to what that diet is set up for that person. Yes.
Are they CPR trained or they will just call 911?
So are they CPR trained? Yes, they are CPR trained. Depending, will they call 911? It depends on if there's a do not resuscitate in place, if, they'll open a 911 call unless it's like, no, we just want to have nature take its course here. But they are CPR trained. Okay. So I think, in summary, the caregiving agency, we provide that day-to-day persistent care. When other components come in and come out of the whole system, we're there to scale with you as you would need support, and really work as part of the team as problems come up to try and help come with creative solutions, especially like when you have someone with a dementia or more difficult behaviors. So we work with them. Yes.
Actually, I have a question. As far as how is payment covered, because those can be quite expensive. And I know we have long-term care, but you have to be 90 days first under your own payment before at least our policy kicks in. And 90 days is
Right.
a very long time.
Right.
So we have a policy with great we pay it every month. But
Yeah.
that's the most.
No, it. So what we do is it can get expensive if you're having a lot of hours or a lot of days of care. Long-term care is the best answer. Most agencies are private pay. There are some that would do Medicaid, and I think you'll be talking a little bit about those resources that are available. We do not take Medicaid. We're a private pay agency. So there's a lot of it does come out of the person's, funds. But there are programs and there are ways that you can look at, and we'll be getting into that here. So it might be a nice segue. No. But there are some ways to support and help to a degree. But long-term care is the best answer for that. Yes.
Will your caregivers drive a patient to, I guess it's a client, to appointments that they need?
Yeah. So will the caregivers drive the clients or the patients to appointments? Absolutely. That's part of the care plan we would set up. So if there's certain appointments they're supposed to make, the caregiver can go. I'll even go with them sometimes if there's certain things medically we want to kind of, and the family doesn't live close, to be able to kind of interpret a little bit, what's going on. So they absolutely can drive to appointments. They can take them to do things that they used to do but maybe can't anymore because they can't drive or don't feel safe driving. The goal is to create as much of their life and gain as much independence supporting them. So if that means taking them to the library, it means taking them to visit their friends for lunch, whatever it is, and that's what we'll try to support. Okay? So with that, I think I'll turn it over. I don't know, you're going next?
Yeah.
Okay, so we have the Hospice of the Valley.
Okay, I'm Connie Kay. I'm a social worker at Hospice of the Valley. And we offer hospice services, and you qualify for hospice when you have been given a terminal diagnosis of 6 months or less. And it requires 2 doctors to determine that. So what happens is usually it's your primary care physician when there's no more aggressive treatment that can be done. they will refer to hospice, and then our nurse would come out and do an assessment, and then our hospice doctors would determine whether or not you qualify. Hospice services for anyone over the age of 65 are entirely covered by Medicare at no charge to the patient. Most people who have insurance plans, their insurance plans, if you're under 65, most cover a good percentage of it, up to 80%, with a small copay. We're a nonprofit hospice. We're the first nonprofit hospice in Santa Clara County, and no one is turned away for not being able to pay. So we'll work it out with you. As far as insurance goes, let's go to the long-term care insurance. We'll just start right there. I see a lot of people that do buy the long-term care insurance policies. If you are looking at getting one, they can be a wonderful thing, but I often see cases where people get them and there's a 90-day waiting period. And that long-term care policy, you have to have a skilled need, and it has to be determined by the doctors and the insurance company that you have a skilled need in your home, and then you pay for the first 90 days of that. So if someone gets Alzheimer's, long-term care insurance is a godsend. Someone with a cancer diagnosis that has a short time, they often can't use that long-term care insurance. So it is insurance, just like we buy insurance for our cars, so it's something to always consider. And the care agencies will often help you with that, and go through it with you, and can communicate with your agencies and between the insurance company to help you assess the needs. Sometimes they'll even help with the billing, which can get quite extensive and overwhelming sometimes for elderly to even navigate that system. When people come onto hospice, they've usually been ill for a while, and so there's a lot of things that we have to assess, and my job is to assess everything from where they're at with their estate planning to advance directives to care. And often it can be very overwhelming to determine what kind of care they need, so that's one thing that I'm helping them assess. And sometimes we're piecing it together because finances are an issue, and people don't have money to pay for 24/7. So we're trying to figure out how can we make this work, but still allow the family to be the family and not wear themselves out taking care of someone, because often also when someone comes on to hospice, someone has been ill for quite some time, and the families are often very tired by that point in time. So I start assessing, what is your quality of life for the caregiver? Are you able to get a good night's sleep? Are you able to get to your own medical appointments? Are you able to get out to lunch? And I often see people who haven't been out of the house, they haven't been to the doctor themselves. They're not sleeping at night because their loved one is needing them to be up with them and helping to change them or to handle their pain needs. And so that's one of the first times when we assess, let's hire somebody for nighttime so that you can get a good night's sleep. Because we try to take it in baby steps, because often people are very overwhelmed. People don't want to have a stranger come into their home, and what are they going to do? And they're just going to sit here all night while I sleep. And so, and I don't want to just be paying someone to sit here. So we're explaining to them that that person that you're hiring is not sleeping in the bed. They're up and they're assessing and continuing to assess. It's important for us when we hire someone in the family that they are able to give medications. So that is something that you want to assess when you're hiring a caregiver. Is this caregiving agency, are they able to give medications? There are a lot of caregiving agencies that are out there that they're not allowed to give medications. And I said, well, why would we start off with somebody if we're going to be doing this and you need to go out and they can't help your loved one? Scott's agency does do that. We talked about that before. So, but there's things like that we need to assess. Sometimes we piece it together. There's a 4-hour minimum, which he said that's what we often find. And so I say, well, let's just start off with 4 hours and see how it goes. And often when people start off for 4 hours, after a while they go, oh, this has been such a relief. I was able to get out. I went to the bank. I was able to go to the grocery store. So they're just so relieved by that 4 hours. And as things progress and they need more help, then they become more comfortable with their caregiver. They're more willing to hire for more time. I've seen us piece it together with friends and family and people coming in from out of town. People hire caregivers from all different kinds of places. They find out about them from the neighborhood. The next door neighbors had a caregiver. They get them from church, get them from Craigslist. But as Scott was saying, there can be a lot of issues. So community referrals are great, but I also want people to really assess. You're having people come into your home, and the job that they need to be doing is really important, and it can be really critical, so that you may be paying a little bit more money, but it's worth it to have the wherewithal and the peace of mind that they're getting the care that they need, and they're with a skilled caregiver that can assess and do the things that need to be done so that that patient is taken well care of. Okay. Let's see. So I talked about evaluating the caregiving need and the need for it, and your own health, whether or not you're getting sleep, the skill level needed. Sometimes people are coming home from the hospital or from a nursing home, and it's been determined that they can't stay at the nursing home anymore. They need to go home because Medicare is not going to pay for their nursing home care, so they come home. And you've been watching them at the nursing home, and you think, oh, I can do that. And you get them home, and you go, I can't change that diaper. They're too heavy. I can't even move them. I can't do this. And I see that happen often, with elderly people, because they think that they can do it, but they're just not strong enough to do it. So we need to get help in, and sometimes we need to get it really fast. And sometimes people just need a break. Sometimes they just need to be able to get out. And if it's just a break that they need, then I suggest that they, maybe use friends or try to piece it together with family members. So what if they don't work out? What if you can hire a caregiver and that person doesn't work out? I've seen this happen, and that's one of the reasons why Scott brought up the language thing, is because that can be very challenging also for a lot of our older patients as well, because they have harder to hear, and a language that's not primarily their own, they have a hard time. But I always say, let's try it and see how it goes. And if it doesn't work, then we can get somebody else. And or if I know that it's really going to be a problem, when they're going to be interviewing with the agency, I say, please ask for somebody that has a good command and a good skill level of English that I can understand. And so when they're calling the agency, I will make a list of things for them to ask for, because you've got personality issues like Scott brought up. Sometimes you've got problem behaviors. Sometimes you have physical things that you specifically need to make sure that they're taken care of. And sometimes you have emotional issues with the patient that need to be assessed. And so a company like Scott will do a really thorough intake. Here we go, we're getting ready to take off.
Okay. Yep.
Everybody take a deep breath. So you want to do a really thorough intake and make a list of things, even just little personal things, little things that you think that would help the caregiver to take really good care of your family member, your loved one. Like they don't like chocolate pudding, they like applesauce. Anything that may be important, write those things down so that the caregiving agency can help find the best fit. And a caregiving agency that is doing a good job is one that's going to want to find the best fit for you. Okay? So once in a while it has happened that somebody doesn't work, and you talk with the agency and send somebody else the next day. It's not a problem. And I encourage people, speak up, because sometimes people try to be just really nice, and they're trying to do a good job, and and I don't want to hurt their feelings. And it's like, no, just say something, because you're paying for this service and you want somebody there. These people are in your home, so you want somebody that you feel comfortable with, that you feel like is going to be one of a family member, because often those caregivers become like a family member. You want to feel trustworthy, that you can leave and come back, and that you're not going to have to worry. And sometimes it takes time to build that trust up, but you want to feel off the bat, you need to kind of have a feel, use your senses on this, and use your emotional senses as well as your mind senses on how does this fit work for us. Set your expectations. Know that you're the employer. You can ask for what you want. You can ask the agency what can they do and what can they not do. They don't wash windows. They don't usually do cat litter. But sometimes you can find caregivers that are be willing to do different kinds of things. Red flags. One of the biggest red flags that I see, and I don't know if Scott knows about this, but is that caregivers are on their phones. They're on the phones, they're texting, and when he said that he has them text, that's great because that's fast, that's quick, that's to their boss. But often caregivers are, private hire, they're just, they're sitting on the couch doing this. So set your expectations early. I tell people, tell them if you don't want them on the phone the whole time while they're supposed to be working, that, you can have a break if you need to make your phone calls, just like you would have a break at your job, that you can go off and make your phone calls at such and such a time, and just set some boundaries and be real clear with it so that everybody knows what the expectations are right off the bat, so you don't run into those problems. And if you do run into those problems or things come up, either talk with them, or if you don't feel comfortable talking with them, talk with their employer or their boss. Okay? Sometimes we see a skill level that might not match, and sometimes that's because there could be more pain than might be what expected. Sometimes people come home with pain pumps, and sometimes they require more care. Sometimes they're declining quicker than what was expected. And so that's always a time to talk with the agency or the caregiver to make sure that you get the people in there that you need. Sometimes they can be CNAs, which are certified nursing assistants, all the way up to LVNs, which are licensed vocational nurses. He tries to hire people that have more experience, especially working in the nursing home. I think that's a great idea. So just assess what their experience level is so that you know what you need. The other thing that I see a lot is family involvement or not. Families are families, and families come with family dynamics, and there is no such thing as a functional family. We're all dysfunctional. So that's just the way it is. And I see families where everybody comes together and works it out, and the daughters are coming in, and the son-in-laws are coming in, and the grandkids are coming in. And then I see families, well, let me know if you need any help, Mom. And the mom's like, oh, I can do this. Well, the mom needs a lot of help and won't ask for it, has never asked for it. The kids don't know that mom needs it because mom's not asking for it, or they really don't want to help. So those are times when we need to assess, maybe a caregiver would be good because maybe it shouldn't be up to the family. Maybe the family should, the wife should be the wife. And then the kids can come in and be the kids and help and support mom. And, the caregiver's there and they can come and get mom and take her to her appointments or take her out to lunch or take her to a movie. So those are things that are really important. Having family meetings is something that I do, and I try to do that right off the bat. When people come onto hospice and they go, oh, do you want us there? And I go, the more the merrier. Let's get everybody that's around that we can get them here so that we can all be on the same page. We can all understand what's happening. We can all talk about what's going on. We have the phenomena of the daughter or son who lives in, I always say New York, just nothing about New York, but, and then there's the daughter who's been here taking care and doing it and doing it and doing it, and then the daughter or the son flies in from New York and, oh, you don't know what you're doing, but hasn't seen dad for 3 years. So a lot of family dynamic issues. So what I do is I call those people on the phone right off the bat and just explain who I am, what's happening, what's going on. So a lot of communication. So families need to communicate as well. There's always something to do. So there may be somebody, there may be a man who doesn't want to change his mom's diapers. That's okay. I see that. But there are things that he can do. He can make sure that the grass gets mowed. He can make sure that the bills get paid. He can make sure that there's somebody there that gets the groceries. He can help hire the caregiver. He can, if there's somebody that's out of town and there's somebody here that's doing a bulk of the workload, maybe the person that's out of town can help pay for the caregiver here because they may have more resources to help pay for the caregiver so that the person who's doing the actual care can get a break. So there's lots of ways that we piece it together. Often with friends, I mean, I've had several women who didn't have any family, and we've pieced their caregiving together with friends. Their friends have pitched in to pay for the caregiving when they couldn't be there. So I've seen all different kinds of things work. But communication is really key, and getting support of the team, knowing what's needed and expected in communication. So let's see if there's anything else I was going to say. Yeah, that's pretty much it for me to start. Okay, questions? Yes.
One comment is that one thing you didn't touch on. You touched on a lot of the caregiving side of it, but I know personally because I've dealt with hospice before. There are a bunch of perks or whatever you want to call it for the family members, for the caregiver personally.
Yes.
And,
Yes.
I mean, you didn't touch on that. I wonder if you could touch on that just a little bit.
Yeah, so he wants me to talk a little bit about the hospice services, what that includes. So hospice services, when you come onto hospice, you get the services of a doctor, a nurse case manager who comes out to your home. I'm going to just give you, for instance, for my hospice. So the nurse comes anywhere from once a week to daily, whatever is needed. If a person has uncontrolled symptoms and that can't be gotten under control, we'll have a nurse stay in the home until that patient's symptoms are under control. And that could be anywhere from 8 to 12 hours. So all these services are brought to the home. When someone comes onto hospice, they do not have to go out and go to their doctor anymore unless they want to. But otherwise, we bring services to the home. You also get the services of a social worker, which is me, and I do everything from advanced healthcare directives, getting in-home notaries in to make sure that that thing is done, advanced directives, having conversations, the really hard conversations about what do you want, what would you like for your care, do you want to have a feeding tube, do you want to be put on a respirator, you know, having those discussions that sometimes it's really hard for families to have, and sometimes those conversations haven't been had and people don't want to have them, but the person who's sick has already knows what they want, and it's very simple, but sometimes there's the big elephant in the room and nobody wants to talk about it. So it's part of my job to bring the conversation up and help people with that. We also have home health aides that come out anywhere from 2 to 5 times a week that do personal care, bathing, but they're only there for 30 to 45 minutes, maybe an hour, and they'll give a bed bath, massage them a little bit, change the sheets. So it doesn't take over the care that's needed from a caregiver. We also have chaplain services, and they do spiritual care. They're non-denominational chaplains. And then we also have volunteers that can come out up to 3 times a week and stay with the patient. But they cannot give medications, but they can do any variety of things. I've not seen one do windows, but I have had them come and do gardening. So they do lots of things. We have close to 150 volunteers, and anything that, you know, if I think that there's something that can be helpful, we just put it out to the team, you know, and say, is there somebody that is willing to come out and make a meal for this person, or to take this person to a jewelry class, or to drive this person to an appointment, or to come and play poker, or come and play chess, those kinds of things. So those are all of the services that are available with hospice that are free of charge for Medicare.
You said that doctors were included. Do they actually do on-site visits, or they are there for the nurse to get more information?
So most of our care is provided by our case managers and our nurses. We also carry cell phones. We have direct access to our doctors. Our doctors are there at all times, and the doctors do make home visits if it's something that is needed.
So my name is Sarah, and I'm a social worker, and I work at Stanford with the palliative care team, but also on the inpatient side, and have worked in the community in medical social work for many years, and have become very familiar with a lot of the resources out there in addition to the private caregiving agencies, in addition to the hospice agencies and resources that are available. So I'm going to give you some information on some of those that are available. There's a handout that I left at the front that has some of these on there. Unfortunately, the list can get pretty extensive, and so it's a brief synopsis of the main ones that I'm going to be talking about. But so one of the key things is when we're meeting with patients is kind of what's already been talked about, determining what they need, whether it's meals, transportation, what kind of things they need help with. And then that kind of gives me an idea of what direction to take the conversation with as far as what services to get in the home. And often, depending on the patients, we're referring them to private caregiving agencies. Again, there's tons of them in the area. There's a few websites that actually list them so that you can go to one website and get a broad range of what's available versus having to check. So oftentimes we use that, caring.com, extendedcare.com. There's an elder care locator, does the same thing. So those are a few of the websites that are listed on the email. And those are all mostly private pay. The long-term care insurance has been discussed. It's can be very limited in what it helps cover. So most of the coverage for caregiving at home kind of falls into two categories, and one is the private pay, and then there's also on the other end of the spectrum is in-home support services, and that is a program that's administered through the counties. It is for low income. You're basing the income on the person who's sick and the person who is applying for the services. But depending on where they live and who is in the household number, there are income limits, asset limits, and things like that. Most of the eligibility is Medi-Cal eligibility. So if a person is eligible for Medi-Cal and has it already, then they're eligible for in-home support services. But what happens with in-home support services is they come out and you file an application, they come out and they do an assessment, and they look at what sort of things you need help with. And there's certain things that they're allowed to help with and certain things that, like the cat litter, for instance, you might hire a caregiver for 10 hours a week and they're doing a variety of things, whereas with in-home support services, they have to designate specific hours per specific tasks that they're allowed to do. So they may not be able to cover all of the needs that you have, but they definitely could serve as a supplement. And so they look at what your needs are, they determine how many hours you get per month, and then a caregiver needs to be found in order to have someone perform those duties. Now, oftentimes family members are already performing those duties. So a family member actually has an opportunity to get paid for what they're doing. Or if the family member needs a break and doesn't want to be the caregiver anymore, then you can hire a caregiver who would get paid by in-home support services. And depending on how many hours a month they're allotted, the caregivers can actually get health insurance benefits and other benefits depending on the situation. And they would be hired by in-home support services. But the process is a little different as far as finding a caregiver. There are registries that are available that have lists of caregivers, and they've kind of done the background checks. But the relationship is considered as an independent contractor between in-home support services, the family, and the patient and the caregiver. So, if you have a caregiver in mind, it's easy. It can be easier. If not, there's a little bit more of a search that's involved, and similar questions to ask those caregivers, as has already been mentioned. But that is a resource that, if the person's income is low enough, that there's no charge to the patient. And some people are eligible for Medi-Cal with a share of cost, and so there also potentially could be the assistance available to the patient, but they may also have a portion. But other than, and remaining in the home, there are some other programs that are out there through Medi-Cal as well, but they're a little more complicated. They may be, there's a waiver program, it's called Medi-Cal waiver, some for HIV patients, there's some for other chronic illnesses that are long-term with patients who they want to keep out of a facility and keep at home. Those are less available, but there are some other programs that are available that could be accessed through Medi-Cal as well. Connie touched on hospice, home health has already been talked about. Those are all things that are possibilities, but they all come with specific criteria that you have to meet and maybe short term. Another program that a lot of people are not familiar with is if you're a veteran, the veterans benefits have an aid and attendant program where it's similar. You have to meet certain criteria as needing help with your activities of daily living. And the way it usually works with them is it comes in the form of a pension, and then the person is responsible for paying the caregiver. So again, a similar process as to finding a caregiver, but the funds to pay for it then come out of. So there's, in the information I sent, the phone number for the VA benefits and the website is in that information, because there is an application process and determination with that as well. If a person is a member of like the Elks or the Eagles or some sort of organization, oftentimes they have, whether it's other members who are willing to do things, sometimes they have financial assistance or other volunteers that are willing to come in and help with some of the caregiving needs. Disease-specific organizations often have financial assistance, again, for a variety of things. It might be even just transportation, whether it's American Cancer Society has a transportation program to help patients get to appointments if that's what they need. Other organizations similar, Lymphoma and Leukemia and Lymphoma Society. There's HIV organizations that have funding. So depending on what, cystic fibrosis, a variety, Alzheimer's Association. So a lot of those associations out there that are tied to a specific disease often have a very specific program or scholarship available to that population. So it's always good to look into some of the choices with those. Any religious organizations, again, was mentioned, the church, maybe there's volunteers there. There's an organization in Santa Clara County called Love Inc., and it stands for Love in the Name of Christ, but basically what they are is they are an aggregate of volunteers from a variety of churches and other organizations. And so it's a volunteer pool. So they've all committed to wanting to be volunteers and help out in the community. And so there isn't really any religious push. It is that sort of organization and affiliation, but they basically provide volunteers in the community. So if you have a need, you can call them and they can see if they can find a volunteer in their huge pool to see if anyone is willing or able to do what's needed. There's another organization in Santa Clara County called Heart of the Valley Services for Seniors. It's another similar organization. It's a lot smaller. It only serves certain communities, but again, very see what the need is, and you can call and see if they're able to provide it. On another level, there's obviously different levels of care if a person isn't able to be at home, whether it's assisted living or adult daycare, where the person's may stay in their home, but they go out for adult daycare during the day. Some of the adult daycares do accept certain insurances, and so sometimes that alone is, if the family member is still working, then the patient can go to the daycare center during the day and then be able to come home at night. So that, oftentimes helps with some of that. There are organizations in both Santa Clara and San Mateo, as well as other counties, that have low-cost transportation for people with disabilities. In Santa Clara County, it's Outreach. In San Mateo County, it's called Ready Wheels. So oftentimes, that will relieve some of the stress for family members if they need transportation just to their appointments. Meals on Wheels. So it may not even be a caregiver, but it may be bringing in, a select few different services that are helping with some of the daily tasks that are needed. You had a question?
Do you know for Meals for Wheels, is there an income level requirement?
So Meals on Wheels, they have income levels, but how they normally work is based, and I'm more familiar with Santa Clara County than I am with San Mateo County, but they have what they call a contribution that requested. It's like a donation. So if you can't pay, they still provide the meals. They have more funding available for 65 and older, but there are some funding for people who are under, or 60, I think it's 60 and older. And so those who are younger, they often get grants from other places. So they do ask your income, and they do have certain fees, but they also understand that not everyone can pay, and so it's a recommended contribution. Mm-hmm. And then a couple other things for family members to consider, especially family members who are working, is that there are benefits through your employer to take time off, as well as through the state for you to get paid for some of your time off. One is the Family Medical Leave Act. You are allowed up to 12 weeks in a 12-month period. That can be a calendar year. Sometimes it's a rolling year from when you start using it. Every employer has it different, but
You have to be working at least for 1 year, and the employer has to have at least 50 weeks.
right. So there are certain requirements, but it is an option for job security for some people. And oftentimes employers are willing to let their employees take time off without the eligibility piece. And then aside from that, you are able to get paid. If you're paying into state disability through your paycheck, then family members can get paid for providing care to their loved one up to 55%, up to 6 weeks. So, some of those things are also ways to, alleviate the stress. If you need to take time off work, then you might know that you're getting paid. And oftentimes employers, if you have PTO, that's able to supplement the paid family leave. So you're not using all of your PTO at once. You're staggering it out a little bit. And then the other thing I wanted to talk about, which isn't as helpful in the home, but helpful to the caregivers, are support groups. And so there's a lot of support groups that are associated with various disease groups. There's support groups in the community that are for just caregivers in general. So oftentimes that is helpful for family members to be able to access support groups. And then, there are organizations in the community that also provide counseling to family members and patients who maybe dealing with a chronic illness, a terminal illness, and as well as employee assistance programs usually offer, 5 to 10 sessions with a counselor. So just some other resources that are potentially available depending on the person's circumstances. So often when I'm meeting with a family, these are a lot of the things that we're going over. What situation are you in, and how can we get, some of these other resources in place? Any questions? Just make sure I'm not forgetting anything.
Does one need a referral from their Does one need a referral from their doctor to get your services?
In the hospital or in the clinic? No. Usually the doctor, so she wanted to know if a referral was needed in order to get social work services. No, so there's usually a social worker assigned to every patient that's in the hospital, as well as to each of the clinics. They're very busy, so sometimes it does take asking the nurse on the floor, or asking the physician, or asking the front desk if you're at the clinic, asking them to speak to us. Oftentimes they recognize that there's things going on or things that are needed, and they'll also request us to either see you while you're there or contact you and help get things in place.
Is there a list of support groups? I've got your handout here, but is there a list in the handout, or?
There are so many. I did actually bring, and I just didn't end up making copies of it. I do have a list from a website of the caregiver support groups in Santa Clara and San Mateo County, and it's of the agencies that have them that chose to post their support groups online. So I can at least give you that website, or I can, we can figure out a way to get that information to you.
Why is it the best kept secret at Stanford, the list of support groups in the Valley?
There's so many support groups.
Doesn't matter. Why is it the best kept secret? Why?
Oh, I don't think it's a secret.
It is a secret.
Is it?
Yeah.
So she wondered why it was the best kept secret for support groups in
Not out
Stanford.
there for us to find it instead of not being.
Well, we tap into all the support groups in the community. So oftentimes we're looking, if a patient comes to us, we don't always know where they are. We don't always, they constantly change. We all work in different disease groups. So we may be familiar with the support groups in ours, but if we're being asked about others, we're not as familiar. So, and so they try to, make available all the other ones that are available. We have all the ones available at Stanford, but all the other ones in the community are hard to keep track of. So we're constantly calling, is this support group still going on? Is this one still going on? It's a challenge for all resources because they're constantly changing. Agencies go out of business, things like that. Yes?
You kind of touched a little bit of a fair amount of the in-home support.
Yes.
How do you go about contacting them?
So he wants to know how to contact in-home support, and that is in the handout. But there's a phone number and a website for each county, yeah. And so you go to that particular county.
You tell them, and you find out if you're eligible.
Yeah, so you make a call. They take your information. They can give a lot of that information over the phone. They can do a screening over the phone. But then there's also an application process if you move forward.
Do you have any idea how long that takes to go through that?
Depends on the county. It depends on the urgency. Santa Clara, right now I'm not sure, but it has been 2 to 3 months potentially. So again, it may not be something that's...
Well, not me personally.
Well, and sometimes you can request it to be expedited, but that is often a challenge as well.
I think you were talking about you have no idea how fast things can change. And it is so true, because my wife was one of those unheard of, 7 years with ovarian cancer, and, she was doing strong, and then just recently she's just started plummeting. and I mean really vomiting. So down to the point where we're afraid to leave her at home alone right now at all. And because she, like today, she fell and she couldn't get out. So we need to get a hold of in-home support or something. Yeah. We are signed up with hospice, or at least we got the referral in yesterday for hospice. But above and beyond hospice, we'd actually have in-home to even if it's just to sit there.
Yeah.
Don't you have to have Medi-Cal to get in-home support?
Yes, yeah.
So you need to qualify for Medi-Cal to get in-home support. In-home support is an arm of Medi-Cal.
Oh, okay.
And
Well, that's a possibility right now, anyways, because she's working on Cobra.
Okay.
And she's supposed to be running over.
Okay. So Medi-Cal is an income-based program, and so you can go online to just Google Medi-Cal, and you can do the application online. You can determine whether or not you qualify right by going online, and you can apply online.
Yeah. I'll do that.
Yeah. Get it started.
You have a question back there?
I have a question for Scott.
Okay.
Yes.
You didn't mention anything on if caregivers, particularly your agency, are trained in any way to deal with social dementia.
Okay, yes. We deal with that quite a bit. Dementia. So the question is, are caregivers trained to deal with people with dementia? And, yes, we work with that quite a bit. We work with each individual caregiver in each individual situation, because the person with dementia, what you see today is typically rooted in something that happened in their past. We try to learn as much as we can about that particular person, about the type of dementia, because there's everything from Alzheimer's to Lewy body, and each one presents itself a little differently. Each of it has its own challenges in how you deal with that person, and the medications and all those different things that go with it. So we try to train them on just kind of what to watch for, how to work with the person. We're very involved with the families too, in case there is a change, because those situations change constantly, and it can be something from, they may get a urinary tract infection, which makes it seem like it's much worse, but it's really delirium, than the baseline dementia. So yes, we work with that quite a bit. We train our caregivers specifically when we work with those families on how to work with them. We stay in touch with them. We have specialists that we rely on to talk to if we have something new that maybe we haven't seen on how to deal with a certain situation. But we've seen a lot of different types of behaviors with different types of dementia. So we typically have a lot of suggestions on how to work with that, with our caregivers to work with them. But also, we're available to talk to the families too. And, our knowledge is their knowledge, because, it helps, makes it a little easier on them too. Because they're used to seeing this person one way, and it's not that person anymore. But the person's there at times, but it's just hard to kind of see them changing. So we do, well over 50% of our clients are. We do a lot of 24/7, a lot of that is dementia. Okay, welcome.
Another question on the phone. Sorry. Go ahead, Joe.
Yes, Eva.
Well, you mentioned 4 hours.
Mm-hmm.
Is that the minimum per day?
Yeah, that's what we look at, and the reason why we look is a 4 hours a minimum is what we're looking at. Is
But not per day, it's not just, doesn't have to be 5 days a week, just.
no, just per day. It's a day, and a lot of
Do you require more than 1 day, for instance?
no. It typically families. Our philosophy is we scale to what the family needs.
Talk to agencies that require more than 4 hours.
Yeah, there's some out there more than, we do 4, and it can be 1 day a week. It can be, because typically, people find once it starts, at least they have the caregiver in the home many times. That's a big barrier, especially with our elderly. They're fiercely independent, and there's 2 things that are really difficult for them: losing their driver's license and having a caregiver come into the home.
Are those 4 hours a day continuous?
Yes, typically, because the reason we do that is the caregiver needs to drive from somewhere, and it makes it kind of worth their while. We sometimes relax that if we have a caregiver in the area that's working on another job. And sometimes we'll do a split shift around another shift. So it all depends on kind of what's happening. We try to work with the families the best we can, but we do say as a 4-hour minimum, just in the worst case scenario.
So if you wanted 4 hours, and you only wanted 4 hours a week,
Mm-hmm.
would you be able to have the same caregiver assigned to you each week?
We strive, that's one of the notes I wanted to cover, we really strive to keep the same caregiver coming out there. If it's the same day, same hours, we have a better shot of it than if it's a moving target. You know, if we can keep that same caregiver, we'll do everything we can, especially as we get into like, you know, a dementia case or something like that, or any case, because there's a lot of trust that, you know, this is a person coming into their home and you want to be able to trust them. So we really try to keep that stable as much as we can.
I have one more. In my situation, my mother's disabled and my father has Alzheimer's.
Mm-hmm.
So, would one person be comfortable? I mean, they're not. I do it, but you know, would a person be comfortable with one caretaker?
Would one of your?
If you have, would one of your caretakers be comfortable taking care of two people?
It will depend. We'd have to take a look at what's required of them. You know, when we look at putting a caregiver out there, we match in a couple ways. One, first and foremost, is skill set. So can somebody handle, you know, both, and how much of their time do they need working with each person? You know, that'd be the key. The second one we just do is on personality and things that kind of make it magical. You know, but yes, we have situations. We have one caregiver caring for a couple. It would just depend on kind of what they're doing and what the demands are on them. Okay?
Do you charge more if there's two people?
No.
Okay.
No.
I sometimes do see that they
Yeah.
charge more
Right.
for the second person. So
Yeah.
it's good to know.
Yeah, we try to keep things pretty upfront as far as pricing and all that too.
My father's, it's not much, he's got the Alzheimer's, it's not much, you know, he just kind of doesn't know what's going on.
Uh-huh.
Yeah,
Yeah. But is he active, or, you know, sometimes people they sundown at night and, you know, it gets a lot. It just depends. But if he's pretty easy, and if it's just a matter of keeping an eye on him, keeping attention to him.
Where I'm at right now, it's just,
Okay.
you know,
Yeah.
sitting there watching if they don't do something.
Yeah. And your mom with the disabled, how is she
well,
pretty?
She walks with a walker.
Yeah.
But she falls. I mean, I can pick her up when someone else to, but, you know,
Yeah.
and that doesn't happen a lot, but it does happen.
Yeah.
And just kind of needs help doing things.
Okay.
But she's independent enough to go, you know, take care of herself.
Yeah. Yeah. Now, a caregiver, you know, we'd have to look at each situation, but it is possible.
And does she have Lifeline?
No.
Okay, that's one thing that we
That's good.
recommend
I
often.
work from home. I work full time, but I work from home, and I'm
Okay.
pretty well there all the time. And right now,
Okay.
I just have two phones dialed to me, so I just push one button.
Okay, okay, good,
Good.
Yeah.
good.
Good.
Okay.
You got your own lifeline.
Yeah.
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 Okay. That's great.
One of the other resources in the community that I wanted to mention, as I was thinking about what you were mentioning earlier, is there's a growing resource in the community. Hospice of the Valley has one of them. Mission Hospice has the other in San Mateo County, and they're considered transitions programs. So there's some will compare them to hospice in a way, but it depends on what services they're able to provide. But they have a 12-month or less life expectancy versus a 6-month, and it's mostly volunteer-driven, would you say? So there's still activities and stuff that, again, things that they could get a volunteer to do. It wouldn't be, you know, a lot of the hands-on caregiving, but that can also become a big resource, even if it's having someone come in and sit with the patient who, you know, might not need a lot of help like you're mentioning, but they might give the family member an hour break to go to the grocery store, or help with some of those things that a volunteer might be willing to do. So there's something else I thought of and I forgot to mention it.
Also with our hospital, like through hospice or Valley, is that who you were talking about? Do you know who Carol Ketchum were?
Carol?
Carol Ketchum and Carl Ketchum, have you ever heard of them?
No.
they're involved in. Carl's an elderly man. He'll come in and he's an extremely good violinist. He'll come in and sit with people and do nothing but either tell jokes or play violin for them. And that may be all they do, just sitting down with them, just giving them attention. Yeah.
We also have a palliative care clinic that has recently opened for people who are seeking further treatment, that want to have support, pain management, et cetera. And I brought materials for the palliative care center over there as well. And the transitions program is available to somebody with a 12-month, a life-limiting illness is what we would call it, and that is a volunteer. And then you also get social work support. So I think the question is like, how do I get you to help me, because you know so much, and that you ask your doctors or you go to the palliative care clinics. You're going to take her list and look, but really mainly also senior centers are a really good place to get information, because they usually have a social services person at a senior center that knows a lot. They're just full of information, so that's a good place to look for information as well. If you haven't been to your local senior center, I recommend going. Yes? The question is a range of cost for caregiving. And we've talked about all the different kinds of caregiving and the different kinds of caregivers there are. So I've seen everything from $10 an hour to $28 an hour. So that's a wide range. And that's from, you know, a neighbor or somebody that knew somebody from church, to agencies, to private care agencies. Maybe somebody that doesn't have as much experience, to someone who has experience that can assess and manage an Alzheimer's patient, that can give medications, that can dress wounds and do the stuff that's really needed to be done, that would keep a person out of a skilled nursing facility and keep them in their home.
Is this generally a contract-driven relationship?
So there, yes, there is. We have a contract, but it's not. It really just outlines kind of what we do and what we don't do. There's not. We don't have anything where you have to give us a 2-week notice or use us for so many hours. We realize it's dynamic, realize it's flexible, and for us to. If you're asking us to leave, it's probably not good that we're there for another 2 weeks because something went wrong. Fortunately, we don't do that very often, but it happens. And for whatever reasons, the person goes into a home or something changes, we don't require any. So yes, there are contractual agreements on pricing and terms and stuff. And I'm happy. I mean, what does it cost for private pay? I mean, our agency, I think we're kind of in the middle, and you guys can probably speak to this too. I mean, we're $25 an hour for hourly, and if you do a live-in, right now we're at $265 for a 24-hour period, and that includes $265. I think we're pretty much middle to middle, a little bit high. You can find some for less. You can find many for more, but that includes everything. The cost of the caregiver's wage, the cost of the of all the taxes, all the workers' comp, which is not small in this industry, and everything else. So it's the full bill plus the oversight and management.
Are all the caregivers supposedly bonded?
We bond our agency, yes, yes.
But do all of them? Or
No.
You have to ask.
Yes, that's a question I would ask. There was recently legislation passed this year that was signed where they're going to license all home care agencies, which they aren't licensed right now. They really should be. I mean, we agree with it totally. And so, there's certain things like you have to have, certain liability, you have insurance, you have to have, workers' comp, you have to have the dishonesty bonds, you have to do the background checks. All of these different things are coming that all agencies will have to do. And, we welcome that because we were well above that threshold with ours.
Well, if someone does damage to your home, they're responsible, right?
The agency?
Yes.
If the caregiver does something to the home,
Right.
our agency is responsible for that. And We generally err if it's, yeah, we do, but that's just the way we figure if we can. We had a situation, I'll share an example, where someone put, we don't know who did it, but someone put a wipe down the toilet and it plugged up the whole thing. And we don't know if it was our caregiver or not, but we picked up the deductible on that whole thing, just no questions asked.
Is that true for all agencies? Or
No.
just yours?
No.
So that's something we need to ask.
Yeah.
Yeah, you
Bring
need to
somebody
ask
in
that
to
up
help.
front.
Yeah.
I didn't do that.
Yeah.
Another thing for private hire is you need to assess your own homeowner's insurance. That if someone is in your home and you've hired them, are they going to be covered? And so that's something I always recommend, because
Yeah.
you may hire somebody from the church or somebody that you know in the community, and because you're hiring them, there may be some clause in your homeowner's insurance that won't cover them if they fall and hurt themselves.
Right. You do want to
So-
put that rider on there.
Yeah, so there's lots of things to assess, and so that's why somebody that's got the insurance and is actually above board and paying this person's taxes, paying into the system and covering them is of benefit to you in the long run. Yeah. Yeah.
You're welcome.
Yeah.
Yeah.
I have a question about
to-
the adult day program. Do you know of anyone that runs in the evening and weekends?
Evening and weekends adult daycare.
I'm not sure. That would be one of those things that I probably would have to call the places that I'm aware of and check. You haven't found it yet? Oh, sorry.
I haven't heard of it.
Mm-mm.
You know.
I haven't either.
Not late, I mean, like maybe extended, like 6 or 7, but not later into the evening.
There's a new business for somebody, a new business opportunity.
For those people that don't sleep.
Yeah.
Did you have a question?
Yeah, do you rotate individuals who are live-in carers?
Yes, absolutely.
2 weeks, or what's your...
What we do is we typically, we assess kind of how difficult the case is. And you know, and it's typically we do 5 days and 2 days. So 5 days of primary, 2 days of reliever. Sometimes we go 4-3, sometimes we go 3-3-3-3. You know, it just kind of depends the situation we're working with, and you know, we try to look at is the person safe, but are our caregivers safe too, and are they, you know, because we have to watch out for them, and we pulled caregivers out of places where it wasn't safe for them. Yeah.
I actually managed the care for my badly disabled sister-in-law. She was blind, disabled, had a whole plethora of medical issues. For more than 10 years, I enabled her to live at home in England, and I managed that long distance.
Wow.
So I have lots of experience.
Yeah, you do.
But at the end, I tried desperately to get a living carer for her. She was having more and more frequent, very violent epileptic seizures, and ran into employment regulations in the UK that made it absolutely impossible to hire anybody because of minimum wage and maximum hours and all this sort of nonsense. A year ago, this is what I was dealing with.
Yeah. Well, it's coming here too. I mean, you know, there was other legislation passed this year where it will. You can still, right now, that there's a wage order that allows caregivers. We don't pay them while they sleep, as long as they get uninterrupted sleep. And if they do, we have a method where if they're up, they record that and we pay them. You know, but if they aren't, you know, we don't have to pay for that time. You know, there's some changes coming where we'll be paying some overtime, so living care will get a little more expensive starting, you know, beginning of this year, and then the minimum wage goes up, and you know, in July, so it'll go a little more expensive there. But you know, we think we found a way to still keep it very reasonable. I mean, without being really like, you know, paying someone there every hour for an hour, you know, and overtime and all those things, or having 3 caregivers come in every 8 hours.
I would think that would be hard to enforce, though.
What's that?
We get sleeping. No.
Yeah. Well, you know, it's interesting. They're pretty upfront about it. You know, some, yeah. But if someone's up that much, we know we have a bigger issue, and so we'll typically bring a caregiver in to get the one sleep at night. We find ways to make sure our caregivers are getting sleep, because if they aren't, then the client's not safe. And that violates why they're there in the first place. So yeah, it's complex.